Hi everyone, welcome to our ALF training webinar number 10. On the line with me is my beautiful wife Cheryl. How are you doing, Cheryl?
Good, thank you.
And we haven't done a webinar in a while. It's been a long summer. I'm sure everybody's been quite busy, but we did an in-person event. We've been busy doing a lot of other things, but we just wanted to get back into it and give you an update on some of the new regulations and also our annual two-year survey, right, Cheryl?
Yes. School's starting soon, so things will be back to normal.
Yeah, so we'll try to get back on track. These webinars aren't just good for you, they're good for us as well. Our survey we're going to go over, we got cited for some things, and I think they're really good things to people can learn from. So let's get into it. First, we're going to do the regulation updates, right?
Yes.
Okay, because the Florida legislature and the governor, they passed new updates to the law, and they are currently working on a new 58A, which will be released sometime in the fall. I think there's some great changes on there, and let me just pull that up here. We got a letter from the Department of Elder Affairs that highlights some of the things. Okay.
It's up.
Okay, good. So, first and foremost, 58A is not updated. So until it's updated, none of these things are in place, okay? Including the training regulations and all that we'll get into. So first of all, one of the key components contained in the bill is that it requires limited mental health licenses for assisted living facilities that serve one or more residents who meet the definition of mental health residents. Providers will be required to submit an application for specialty license, okay? So what was it before, Cheryl? It was three? It was three or more. Yeah, and now if you have one, you need a license. Licenses are free as of right now. They're pretty easy to go through the process, but there are additional requirements like an initial training, an annual training. And Cheryl, do you know a lot
They
of
also need a community living support plan filled out. It's an extra paper.
Right, and that
extra form.
Is a lot of times people ask us what determines a limited mental health resident. It's not just somebody who has a bipolar or something like that listed on their 1823, right?
No, it's actually they're receiving SSI or SSDI for the mental disorder. So they're and also you need written verification too. You know,
and the community support, or what was it called? The community
living support plan.
Right.
So there's just some different requirements, but it's not that big of, you know.
Yeah, but if you have two people in your facility and you didn't need the license before, well, now guess what? You better get started on that LMH license, because if you have one or more, you need it.
Right. And I'm sure they're going to be looking out for that and checking too.
Yeah, so get on it. Of all the things that I see in this update, that's the thing that's going to affect people the most. They need to get on it right away. Okay, the next thing that it did was assistance with self-administered medication training. The initial training was 4 hours. It is now going to 6 hours. So new staff who will be assisting with self-administered medication will need a 6-hour training. Currently, it's not active, so new hires just 4 hours. I'm not quite certain on the update, the annual update. From my understanding, it was still 2 hours. You know, stay tuned for our webinar when the 58A comes out to make sure that it is 2 hours. And the 6-hour and the current 4-hour cannot be done online. It has to be done in person. But the annual update can be done online as of this recording. Okay, so some of the additional duties that unlicensed staff will be allowed to provide assistance with in an ALF with a standard license will be pre-filled insulin syringes. So unlicensed personnel can assist residents with pre-filled insulin syringes. So they can probably take it to them, remind them, prompt them. They can also assist with nebulizers, including filling pre-measured doses, glucometers, check blood sugar, embolism, stockings, TED hose, applying and removing oxygen, and the use of positive airway pressure devices, continuous positive airway pressure devices, measuring vital signs, and assisting with colostomy bags. Those are things that unlicensed staff will now be able to do once 58A comes out. Good changes, right, Cheryl?
Definitely. Right. I mean, things that need to be changed, in my opinion. It's just, it's hard. It disqualifies a lot of residents, with nebulizers and insulin and small things that can be handled in an ALF with a standard license. So it's definitely a positive change.
Yeah, so somebody that, maybe just needed some assistance, they could still do some of these things on their own. Now all of a sudden you need to be done by a nurse. It just adds to the cost. It limits their choices, and I think it's a great thing. Okay. So they're going to be working on 58A. They're doing it right now, and it'll come out probably in the fall.
This fall, hopefully.
So like I said, it is currently the medication training is still 4 hours and 2 hours, but be aware that when this comes out, that's 6-hour training. It may be hard to find initially, so you need to start letting your pharmacy know that it's going to 6 hours. You need to start finding those locations that you can get that 6-hour training done. The location, like for example, in Brevard County, we use a training provider for the 4-hour training called Cassell. I mean, you need to contact them and see if they're aware that it's going to 6 hours. And
our pharmacy does it too.
Our pharmacy does it.
They hire a nurse that does it quarterly. So if your pharmacy doesn't do it, maybe you should talk to them and get them to hire a nurse and offer that.
Right. Okay. And, something we are considering expanding into would be coordinating these 6-hour trainings around the state. So that's just something we're thinking about right now. We'll go into another thing. So also what it's going to do is it's going to clarify that residents may be admitted to an extended congregate care ALF if they exceed the initial admission criteria for a standard ALF, as long as they can be served within the ECC criteria. So I think 58A and 429 statutes right now are not clear that you can actually admit somebody who is on the level of ECC and above the level of standard license. It's going to also require a 6-month provisional license for ECC's facilities in operation less than 2 years. So if you're within 2 years and you apply for an ECC license, you're going to get a provisional license. Once you pass the survey during the provisional period, then you'll get a regular license, which makes sense to me. Another thing which is really great is they're amending the definition of limited nursing services, LNS license, by removing the ability to limit nursing services performed in rule. So prior to this, there were limitations on what nurses could do in an LNS facility. Now, I know there was a lot of confusion and nurses did those things anyway, but this makes it crystal clear that nurse can provide services up to their scope of practice, up to their license level within an ALF. Now, I think what it'll do on the alternative is it will not allow you to provide services with a standard license. Right, Cheryl? Don't you think that, because I know that some people, maybe they're a nurse and they think, well, I'm a nurse, I have a standard license, I can do these things with a standard license. But I think this is going to make it crystal clear that if you want to provide any nursing services, even if you're a nurse, you're probably going to need to have an LNS
license.
Right, license. And there are things that go along with having an LNS license, which are, more frequent surveys, monitoring visits, additional renewal license fees, things like that, more documentation. So they're going to require the agency to deny or revoke a license if the ALF has 2 moratoria within 2-year period, or a citation for 2 or more Class 1 violations from unrelated circumstances during a single survey, or citations for 2 or more Class 1s on separate surveys within 2 years. So they're going to deny or revoke licenses with these situations, and I can understand that. The bill is going to require agency to impose a moratorium on an ALF that fails to provide the agency access during an inspection, and clarifies that ALFs may not restrict agency staff from accessing and copying records or conducting confidential interviews with staff or residents. And it also eliminates the requirement for a 45-day notice of discharge if the ALF is closing or must relocate residents due to agency action. So let me just want to clarify, right, Cheryl? If ACA shows up,
you'll have to let them in.
Yeah, you gotta let them in.
Hopefully, your staff lets them in. You definitely train your staff, to
You can't pretend that you don't hear the doorbell. You gotta let them in.
But that's in your, the 2-hour training that we're required. That would be something that would be good to put in there. Is introducing ACA, who it is, and what to expect when they knock on the door, so that they don't turn them down and shut the door, because it's possible that your staff does it.
Yeah, because listen. I mean, I know you as an employer, you deal with this. You tell people certain things, and then they don't. Maybe the lines get crossed, or they don't exactly follow through. But this would be a situation where if you didn't explicitly say to your staff during training that, hey, if an agency shows up, an ombudsman shows up, anybody shows up, you let them in. And if they ask for records, you let them have records. Just look at their badge, whatever it is, whatever your protocols are. But it would be something that would make perfect sense, because I could see that happening, right? Somebody shows up at midnight. We had
one.
A midnight inspection because somebody said our staff were throwing parties, and who knows what they made up. So
maybe, yeah.
And remember, staff must be able to access the records. There must be somebody on staff. So don't put a lock on it, and don't tell the people what the code is, because they got to be able to access it. Okay. And then effective October 1st, new employees who have not completed core training must attend a 2-hour pre-service orientation before interacting with residents. Topics must include must help employees provide responsible care and respect resident needs. Employees and the administrator must sign a statement of completion, and the statement must be maintained in each employee's file. From my understanding, this is something that needs to be done by the facility itself, teaching employees, like Cheryl just mentioned, policies and procedures. How do you deal with situations? Right.
Yeah, how to deal with inspections. And letting them know that it could happen at 2, 3 in the morning when you're not there.
Right. Where are the incident reports? Who do you notify in case of emergency? That all these different things, put it in a training program, give it to your employees, make it part of their initial training. Don't just take somebody right off the street to fill a shift and plop them in, because they won't have this 2-hour training. Mm-hmm. So, and then remember that the employee and the administrator must sign a statement of completion. So
that's going to be something people forget to do probably.
Yeah. Well, if we can do most of it online, and then you guys do a follow-up portion in person, then we could do it on the certificate. But anyway, we're not offering it right now. Okay, the last thing they're going to do is they're going to add more information to ACA's website under the facility locator. Things like occupancy, number of private and semi-private rooms, bed hole policy, religious affiliation, language spoken, availability of nurses, payments accepted, bankruptcy indication, recreational and other programs. I don't know how they're going to get all this information. I don't know how they're going to get occupancy level. What you think they're going to just maybe ask during their renewal, but those things change all the time. So
you don't want to put 100% because you don't want to discourage people from calling.
Yeah, especially if it's going to be 100%, and then that's going to be in there for a year, and you're going to, I'm not. I have rooms available, So, okay, and then you can email any questions to assistedliving@aca.myflorida.com. We will put this letter on the website on careassociation.org under training, so you can find that attachment. This letter you can use if the ACA surveyor says that you need 6-hour training for the initial or any of the things, but it hasn't taken effect. And this letter, you can use this to point it out. Okay. Next, we talk about our save ratio.
You cut out. I'm sorry.
We're going to talk about our survey.
Yep, you're back.
Okay.
Our survey.
Our survey. Let me stop this. Okay, our survey was fun. It's I'm really glad that we get to go through it again with all of you and relive it.
Well, it's only fair that we do it, since we do pick on everybody. We don't pick on anybody, but
no,
we don't. We'll pick on ourselves.
Yeah, well, we
had some good learning things. I
mean, Cheryl was very thorough in her survey, her mock surveys, her preparing. But this just goes to show you that still going to have some things come up. But we're happy to share them with you, and we're not embarrassed because we know that this stuff happened. So it's a learning experience. So first of all, we got cited for
hospice.
It was hospice and continued residency. And it was about the interdisciplinary care plan that every hospice patient must have. The interdisciplinary care plan basically states what hospice is going to do, what the ALF is going to do, and both hospice and the administrator or representative sign off on it, and it goes in their file. So
it's
we
not
had
that
something.
We didn't have them. We had the care plans. It's just that they weren't on the form that the surveyor wanted them on. And
yeah, the specific.
Our VITAS team wasn't aware of this specific form that was used in other counties or other areas.
If it's not in the go to your hospice patients, look for the hospice interdisciplinary care plan with a signature on the second page or whatever it says, facility signature, or it might be on the first page, and then the hospice representative signature.
Right, but if you're not sure, I would even call your local ACA office and have them clarify it for you.
Yeah,
exactly what form they want and what they're looking for, because they know what they're looking for.
Right, and we had to
educate.
But the thing is, we had at one point when we first started, we had our hospice we were there's a home team and an ALF team. We were actually on the ALF team, so we had those forms, and whenever we got inspected, we had everything. It was in place. Then we switched over to the home team. Hospice wanted to move us to the home team for whatever reason. The ALF team was getting too full, so they shifted us to the home team, and then the home team didn't use that form, and it was an oversight. So we got everybody set up, and another thing we got cited for was that on the particular person that
one
they
person
checked,
didn't have the updated
1823 with the significant change. Of course, somebody going on a hospice, even though in our eyes, this particular person, it was not a significant. It was a gradual change. But it was definitely a significant change going on to hospice, that event. And so the hospice team provided us with an updated health assessment form, and that satisfied that. So significant change.
Requested. It's just that, if you don't follow up and things get busy, you forget. So those are things to make sure you maybe have a checklist or something.
Right.
To make sure you don't overlook those.
Okay. Next was do not resuscitate order. Actually, Cheryl, can you take this? The alarm company's calling me. Do not resuscitate orders.
I would just okay. Well, the DNR actually was Calay's thing, so let's just skip that, and we'll let him come back to it. The next thing was personnel records. That what happened was the healthcare statement to indicate freedom from communicable diseases. The employees have been working there for quite a long time, or they brought it from another facility, and the forms were signed, but one of them didn't have the doctor's medical license number on it, and the other form didn't have the doctor's address, so they wouldn't accept those as valid forms. So what we had to do was call up our nurse practitioner, come in and check the staff out and give them an updated form. So make sure, I left the DNR for you. So I was just moved on to the freedom from communicable disease.
Oh, right. Okay.
So
Healthcare
that's
provider.
something, yeah, that it has to be done by a healthcare provider. It only has to be done one time and in the file. So,
Did you tell them how we changed our form so that it has, so it actually has their license number, address, phone number, all that stuff, so that
right, that way
yeah.
there's no problem next time.
Yeah, because our form when we initially created it, it just said signature, and that's the problem. Is that's where it started. But anyway, do not resuscitate orders. Well, you guys are all in the assisted living business. This morning we had the fire department came. I got a call saying, from the alarm monitoring company said, "Is everything okay? We're getting a fire signal." And I said, "Well, no, I'm in the building. There's no fire. There's no fire alarms." I said, "Did you notify the fire department?" They said, "Of course." So fire department showed up. It was a total false alarm. They just got back to me. They said that it was a mixed signal that came from Ohio. So that's crazy. Anyway, I told them they need to call the fire department because if you get too many false alarms, you get a fine for it. So anyway, just a normal day in our world, right?
Definitely.
Okay, so the do not resuscitate order where we got cited was with regard to our admission policies and procedures, which we give to people on admission. In the advanced directive section, we explain that we honor people's directives and, we have a policy in there about people's advanced directives. Well, they wanted to see a paragraph in there referencing hospice. So, I went ahead and typed something. I showed them I had something here. They didn't like that. They pointed to the administrator guidebook specifically what they wanted. It was specific text, and I'll go ahead and see if I can share that with you right now. So we had to add that to our policies and procedures. Hold on. Let's see. Here it is. Okay. So can you see this, Cheryl?
Let me click over.
Okay.
Yes.
So basically in the top section, it talks about our policy. We honor their directives. And then in the...
Calais?
Yes? Yes?
It cut out, like got scrambled.
Can you hear me? Hello?
Hi, I can hear you.
Okay. So they wanted to add this paragraph that I highlighted here to say what we do if somebody's on hospice. And this is what they wanted it to say. In the event a resident is receiving hospice services and experiences cardiac or pulmonary arrest, facility staff must immediately contact hospice staff. The hospice procedures take precedence over those of the assisted living facility. So basically, you can find this in the administrator's guidebook, or just go ahead and type what I just said. In the event a resident is receiving hospice services and experiences cardiac or pulmonary arrest, facility staff must immediately contact hospice staff. The hospice procedures take precedence over those of the assisted living facility. Okay, so we got tagged for that, and I know that they were still quite mean to me about this little thing here. Because, anyway, next, let me switch back over to our survey. Okay. So we added that and we got that cleared. You covered the communicable disease.
I did. Next is food.
Okay. You want to take this?
I don't want to take that away from you. Go ahead.
Okay.
Just kidding.
All right. So basically our menus. Yeah. Can you hear me?
I can.
Our menus are labeled from the dietitian, week 1, week 2, week 3. And I think when we first started, the dietitian would actually put the weeks on the menu. So
Sure.
it would actually, yeah, we would have 52 menus, one for every week, and we would just change 52. But at some point, the dietitian, I think what she had, we didn't have 52 menus, but on week 1, it would actually say the weeks that those menus were for. So, because she said, the surveyor said, give me 6 months worth of your menus, and we showed them our week 1, week 2, week 3, 4. We said we start on week 1 on the beginning of the year. Nope, not good enough. So apparently sometime the dietitian took that off of our menu, the weeks. So we got cited for it. So we had to actually create a list saying week 1 was January 1st through January 7th, and we used week 1. January 8th through January was week 2 menu. So we did that through the whole year, and then when they rotate the menus week 1, week 2, the staff make sure they're on the right week, switching off, and we have a copy to reference and say which one it was. But that just happened. I mean, the dietitian, I don't know what happened, because she said, I don't know. I mean, it's on a lot of the other facilities menus. So
Right.
okay, the next one, Cheryl, the food.
The food, for that day we substituted out because the caregiver who was preparing the meal offered what was on the actual menu, which was the roast beef, coleslaw, apple juice, and vegetable juice.
Applesauce, vegetable juice.
Right.
Yep.
Well, the residents didn't want that, so she decided to, they wanted spaghetti and meatballs, so she made spaghetti, meatballs, salad,
From
applesauce,
scratch. From scratch.
and garlic toast. Everything's from scratch, homemade. Delicious food. But nobody drank vegetable juice. Nobody wants vegetable juice. But it was on the menu, so we got in trouble for not offering and serving vegetable juice.
Yeah.
Since then, we've had our menu changed. There was a time when people did drink vegetable juice, though.
No, we still have vegetable juice. What we did is we make sure we have plenty of vegetable juice. We always had this stuff, but it goes to waste. It sits on the shelf. Nobody has it. They offer it. So when the surveyor asked the caregiver, why aren't you serving vegetable juice? The caregiver said, they don't like vegetable juice, right? Just based on her past experience, she didn't offer it. So the surveyor goes to one lady and says, would you like some vegetable juice? And she said, oh, that sounds great. Thank you. So we got cited for no vegetable juice.
One person wanted it.
Yeah, but we went ahead and got vegetable juice. And then the next time, I don't know. Do you think the dietitian had it as a vegetable? I don't know.
No, I don't know.
Then also we didn't substitute coleslaw. So even though we had spaghetti and meatballs, salad, applesauce, garlic toast, we didn't substitute salad for coleslaw.
Right. She forgot to write it down. I mean, it was stressful. They were watching her prepare the meal, serve the meal, and she just, it was just an easy slip up. But something we can correct, and it happens.
Let me tell you, you would have thought we hurt this person's cat. I mean, they were pretty PO'd about this one particular thing. I mean, and I wish there was some scale, some proportion to their outrage, right, Cheryl? Don't you think like there should be?
Sure. Well, when you go to the doctor and you have those scales of happy to sad,
yeah,
it's definitely up in the tens. I was okay.
Oh,
so she forgot to write. We still had delicious food.
It turned on a dime. It turned so. I wish it wasn't like that. Yeah, but
not any worse than the Kool-Aid.
Yeah, it's true. So
we have Crystal Light. Most people are familiar with Crystal Light, the drink mixes. Our residents love to have flavored water instead of just regular water, and most people need to drink water to stay hydrated so they don't get any health issues. So they choose Crystal Light, and so the surveyor was upset, and she put on our survey that we serve Kool-Aid.
Yeah.
Which is, even if it was Kool-Aid, I don't see what the big deal is. If the residents wanted to drink Kool-Aid, resident rights, resident choice, let them have Kool-Aid.
Well, I know that they asked the caregiver, this one particular caregiver that doesn't speak English the best, but boy, let me tell you, when nobody's watching, she's the one you want taking care of your people. She just cares and cares, is so lovely, so loving. And she probably told them, "Dad, this is Kool-Aid." And But
still,
I know.
I don't see what's wrong with
anyway,
having Kool-Aid, Crystal Light, or vegetable.
Cheryl,
vegetable juice is not even healthy. It's loaded with sodium, and it's it's not.
On the scale of 1 to 10, 1 being a little bit angry and 10 being very angry, where would you say the surveyor was with
the Kool-Aid?
Yeah, an 8.
Yeah, I was standing face to face with her.
Okay.
I was like, but it's cool, but it's not Kool-Aid, and who cares? And I just, I'm not gonna
I think
argue.
that's it.
Doesn't matter.
The thing that is frustrating for me, because I know that most of the people out there listening to this, they're in this business because they want to do a good job. And we also want happy residents. We want to take care of them. We love them. They're like family to us. We want their families to be happy. We want them to give referrals to us. People can leave our facility with 30 days notice. I mean, or even sooner than that. It doesn't even matter. So, we're always trying to make sure that they're completely happy, trying to accommodate them the best we can. And I just wish that the surveyors had a friendly relationship with us, because we're all trying to do good. And then if they find bad things, then they can be stern. They can be, that
like really bad things like abuse and neglect, right. And not. But
yeah, but an administrative
job.
thing, that's my dream. That's my wish. I don't want to have to fear them, and I don't think it's helpful. I know then maybe they think it's helpful to be feared, but like I said, we're not doing this we're doing this because we like it. And I know that other people listening to this are as well. So anyway, off my little soapbox here. Okay, so we covered that. Now the next thing that they found, when we opened our facility first, we started with a 6-bed place. And for emergency water, I bought these big 5-gallon jugs from Sam's Club. And I had my emergency water. And as we grew, it got harder and harder for me to maintain these big jugs of water. The amount of water that I would need at our facility currently is 32 residents. It would take up a whole room of water. So during the process of expanding, one of the surveyors said, hey, you can use those bladders that fill up. You can use the fillable bladders. So we started switching to the bladders. So when they came into the inspection, they saw my bladders. They wanted to see my water. I showed them the bladders, and they said, okay, let me see emergency plan. And during the process, I think our emergency plan stated somewhere in there that we were using bottled water. And so we got cited for that. So it was something that just as we grew, it's one of those little things you overlooked. So we had to submit a letter stating that we were switching from bottled water to bladders, and we would fill them up when an emergency was declared. And then we got the letter signed off, and then it was fine. But it was just one of those little things. But like I said, scale of 1 to 10, happy, angry surveyor. It's a pretty angry. So that was fixed, and that was it. Wouldn't you say? We got everything fixed.
It.
Yep. Okay. We like I said, Cheryl said, we don't just pick on, we use these as learning tools, not just for you, but for us as well. And, we're happy to share these things with you. If we ever have our meetings where administrators get together, we share this kind of knowledge just so we all can get better as a group, because in the end, that's our objective, to provide better care and to do what the state wants us to do as far as regulations. Cheryl, I know I really appreciate your time.
Thank you.
I'm not paying you for today, so this was on the house, right?
This one was on the house. Sure. I'll remember that when I'm at the mall next time.
Okay. I think it'll cost me a pair of shoes or something. So one thing before we go, the Care Association, careassociation.org, is changed. It is now the Association for Quality Assisted Living, because small facilities and large facilities both can provide quality care, and that's what you're striving for. But one of the things that we wanted to do was create a website where people could go to and find information about facilities. So we are opening it up to everybody in the state who has a facility. You can add your listing, you can improve your listing for free, no charge, add pictures, add website information, description of services. You can select whether you're memory care, what type of license you have. So if people click on the inquiry, it'll go to your email. This is free of charge. All we ask, the reason why we're doing these type of things like these webinars and the free listing website at careassociation.org is that you think of us when you need training. We have great programs. We have a ALF core training online. It's reasonably priced. We give you access to it for up to 4 months. We include in it the ALF Core exam prep, which is up to 500 questions. We have a subscription program for facilities where you get unlimited access for all your employees for the whole year. So as soon as you hire somebody, you can give them training, login information, and they can take all the training online, bring you certificates. It's really going to help you stay in compliance. We think it's a very fair, reasonable deal with tech support and support that we provide. So look for our future emails where we'll give you more information about the listing on Care Association. And I think I blabbed enough. Cheryl, you got anything else to add?
Nothing else. You took care of it.
Okay. Thanks all. Bye.